This is an update on the female red-eared slider that I performed surgery on last week to remove a fish hook that was lodged in her throat, and she's recovering nicely, although there have been a few slight complications, but as you can see here, she is quite alert and active and has regained her mobility and her defensive responses, and she cares what happens to her, which is always a good sign with Reptile. If a reptile doesn't particularly care what you're doing to it, then that's generally bad news. She is on steroidal anti-inflammatories right now for the pain and inflammation caused by not only the surgery but the trauma from the hook embedded in her throat itself, and also a 10-day course of antibiotics, and she's recovering in that respect nicely. She does still have a little bit of respiratory difficulty. It's not as bad as it was, but with a hook being embedded in her throat, and it may have punctured the trachea, and just the fact that I was told when she was recovered from the lake, she had been attempting to submerge, and the hook was keeping her above water, so she was kind of caught in this fishing line that had her tethered above water, and when somebody would come along, she would attempt to dive, and she was had this hook caught in her throat. So I'm sure that that did quite a bit of damage there. If you got a fish hook lodged in your throat and you're trying to dive underwater and you're fighting it, so no doubt she had some trauma in there because of that, and she's passed some blood clots since then, and also I've gotten some blood clots out of her mouth since then that she's spit up, but she was having a little bit of difficulty, a little bit of respiratory distress before and after the surgery. But apparently the medications are helping with that, and her respiratory issues are not as pronounced as they were. She's getting better, although she still makes some noise when she breathes, and she's not quite 100% yet. So she will remain here for at least the next 2 weeks to a month for observation, make sure she doesn't come down with any kind of infection, and that she's going to be okay with diving underwater and things like that. She also appears to have been injured in this left forelimb. She doesn't often tuck it back up into her shell the way she does the other one, so I'm thinking in whatever event it was where she came to be caught, have this fish hook caught in her throat, she may have been injured by that in the struggle or something, because she kind of tends to favor this left forelimb, so I think that's kind of been hurting her, but it's not, doesn't appear broken. And she's also showing some signs here with the eyes. The eyes are a little bit sunken in more than I like to see, and that can be evidence of hypovolemia, hypotension, and being dehydrated. And so because she just had surgery on her throat, she's being dry docked right now, so she can't be in the water for extended periods of time, because obviously water turtles, they will foul the water. The water gets dirty. They eliminate their waste in the water, and so whenever you have them in a captive environment, in a tub or a tank or something like that, they're going to foul the water up, and that's not good news. If they have any kind of open wound, you perform surgery and they've got sutures or something in, it's not a good idea to let them remain in the water very long. So she's dry docked and is allowed a little bit of time every day to go into some shallow water where she can drink and whatnot. But obviously that's not keeping her as hydrated as she would be, as another aquatic turtle would be if they were in their natural element in the water most of their life. So I'm having to give her also supplemental fluid injections, subcutaneous injections, and I'm going to have to perform that again here in just a minute. But she is quite active and recovering well. She doesn't want to eat yet, and so by next week I will probably have to tube feed her some liquid nutrients formula, plant-based formula. She doesn't want to stay on the table though. But at this point, I'm not going to tube feed her just yet. I'm going to give the medications a little bit longer to work, because it would just be further irritating to her to be shoving a feeding tube down her throat right now. So I'm going to give a little bit more time for the swelling to go down from the trauma of the hook and the surgery, and she'll be okay until then. But doing good so far. She certainly doesn't want to stay put. She's ready to go back out there. And I'm going to get my supplies and go ahead and give her some subcutaneous fluids. Okay, and now the trick is getting their legs extended so that you can give them an injection. And with these larger turtles, they can be quite strong, and it can be quite a struggle to get their legs extended. But I found that if you apply slow and steady, and you may fail at it a couple of times, but slow and steady tension works a lot better, and they'll eventually yield to you a little bit rather than fighting with them. And you don't want to go tugging very forcefully on their legs anyway, because obviously you can injure them. And you just grab their foot and apply some steady but light tension. And the steadier you can make it and the less force you can use, the easier it works out. Because if they actually feel you giving a forcible tug, they'll exert quite a bit of force and try to jerk their leg back away from you. But then what I do is, once I get their leg extended beyond a plane here where I can get my finger in there, I'll put my finger ahead of their thigh and kind of immobilize the leg. They can't tuck it back in very easily. And so I'm going to swab this area down with some 2% chlorhexidine gluconate. And this is my preferred area to give subcutaneous fluids in an aquatic turtle. They've generally got quite a bit of subcutaneous space here in the thigh, and it's also advised in turtles and tortoises not to administer any kind of fluids, injectable fluids, intracelomic or intraperitoneal. In other words, in the body cavity, in the abdomen, and some reptiles, when you need to give a large volume of fluid resuscitation, you'll actually inject that into their abdominal cavity. But in this case, the prevailing school of thought on that is that it causes too much respiratory distress, too much strain on the turtle in their respiration when you fill their body cavity full of fluids. So it's advised not to do that. And what I'm going to be giving her is 10 cc's here of lactated ringers, and what you do is you find a leading edge of a scale and penetrate under it, and fill the space with fluid. And this fluid was pre-warmed. The syringes sat in a jar of warm water for a while. You want to make sure that you warm the fluids up to at least room temperature or slightly warmer. It's a lot more comfortable to the animal if the fluids are warm. And especially reptiles being cold-blooded, they will not absorb cold fluids very well at all. They can be their reptiles already take quite a while to absorb and metabolize medications and any kind of injectable fluid, so it always helps out if it's warmed prior to administration. And this is a 23 gauge needle, which is larger than I normally use for most reptiles, but on the larger ones like iguanas and large aquatic turtles like this, I will use a larger needle like this to help get the fluids in there a little faster. Trying to give them 10 or 20 cc's of injectable fluids using anything smaller than a 23 gauge needle is you'd be here for quite a while trying to get those fluids in there. And so that was 10 cc's of lactated ringers in the left thigh, and I'm going to give her 10 cc's of normal saline in the right thigh. Or did I have that right? Let's see. Yeah, 10 cc's of ringers in the left thigh and normal saline in the right. And I'm just kind of balancing this out. I got some normal saline that was some 10 milliliter syringes that were donated to me, so I'll use those up as well. Try to not use up my ringers as fast. And also there are prevailing wisdoms on I should say two schools of thought on that too, as far as the ringers and the saline, depending on what you're giving it for, the conditions. There are some opinions that say don't use too much ringers because it has a tendency to cause alkalosis and lead to cerebral edema. And there on the flip side, there is also information out there about normal saline that says, well, if you use a lot of it can result in a net cellular dehydration. It's good for quick resuscitation and getting fluid in there, but it can actually dehydrate the cells as it initially pulls water out of the intracellular space. and it can also lead to acidosis. So you've got the lactated ringers, which may cause edema or alkalosis, and then you've got saline, which may cause cellular dehydration and acidosis. So there's all this stuff you got to be worried about, and a lot of people don't realize just how complicated even just giving some some fluids can be, how that can affect metabolism and the state of hydration and the pH and everything else of the patient. It can actually be quite complicated. So I'm just balancing it out and give her and get her positioned right. Give her then a little saline in one leg and little ringers in the other, and again, for anybody that will ever have occasion, any other rehabbers, to give any kind of injection to a reptile, you want to take the needle in under the leading edge of a scale. You don't want to push the needle through a scale. That would be bad news. It works out a lot easier if you take the needle under a scale, and it goes in nicely. And that's she's all done there for her SQ fluids for tonight. I'm sure she's glad of that. She really wish I'd leave her alone. Unfortunately, a lot of times they don't know you're helping. And time to put her up for the night.